Puan Nora, mic. Okay, thank you. Puan Nora, your mic, please. Okay, good.
Sorry, there's
Okay.
a bit of technical issues here. Sorry. All right. Sorry, everybody. So let's start again. Good morning, everyone. Again, selamat pagi. Salam sejahtera. Assalamualaikum dan bagi rakan yang berpuasa, selamat berramadan. Nama saya Nora Murad. Saya adalah pengarah eksekutif di Federation of Reproductive Health Associations in Malaysia atau lebih dikenali dengan RHAM. Reproductive Health Association Melaka yang telah anda lihat tadi adalah host kita pada pagi ini. Mereka adalah rakan kerja kami. Mereka amat aktif dan banyak melakukan kerja advokasi dan klinik bergerak di serata Melaka. Siapa yang tak kenal RHAM di Melaka ya. So saya amat bertuah pada pagi ini kerana dijemput sebagai moderator. RHAM akan mengelolakan webinar bersiri mengenai comprehensive sexuality education, satu topik yang mungkin jarang kita dengar dan patut kita bincangkan. Walaupun topik ini tidak selalu didengar, kita perlu kongsi, kita perlu share dan kita perlu wawarkan. Oleh itu, mereka yang sedang menonton sekarang, saya mohon untuk share di Facebook dan juga di YouTube anda. Kita gembur-gemburkan sikit isu ini ya. Dan pagi ini is the kick-off series, siri pertama. So it's an important occasion for all of us. Dan untuk memulakan siri ini, pihak RHAM mempersembahkan satu topik yang amat penting tapi again kurang didengar di luar sana, pendidikan sexuality bagi anak muda yang kurang berupaya. Tapi sebelum kita mulakan pada pagi ini, saya mahu menjemput seseorang yang bukan calang-calang orangnya. Kalau Melaka terkenal dengan Hang Tuah dan juga Hang Jebat, kita juga ada seorang Sri Kandi, seorang kapten bersekutu dalam Angkatan Pertahanan Awam. Beliau amat vokal dalam memperjuangkan hak asasi dan memperjuangkan hak reproduktif dan sexuality warga Melaka. Beliau adalah pengerusi bagi Reproductive Health Association Melaka. Saya ingin menjemput berbesar hati sangat Puan Hayati Hamzah untuk membuka tirai kita pada pagi ini. Puan Hayati, saya persilakan.
Hello, Assalamualaikum warahmatullahi wabarakatuh. A very good morning. Selamat sejahtera. Hello everyone and welcome to our first online forum series or webinar on comprehensive sexuality education with the topic on sexuality education for young people with disabilities. I'd like to thank our speakers, Dr. Lim Boon Hock and Dr. Kamal Kenny for their participation as our speakers, and also to Miss Nora as our cute moderator. Terima kasih Miss Nora. Dan selamat datang ke FRAM juga sebagai Executive Director. Tahniah daripada RHAM Melaka. Comprehensive sexuality education has positive effects including increasing knowledge of different aspects of sexuality, behaviors and risks of pregnancy or HIV or sexuality transmitted infection. Providing comprehensive and medical accurate sexuality education to all students, regardless of ability level, is vital to the health and well-being of all young people. Unfortunately, there are many myths surrounding sexuality and those living with disabilities. Dan bagi kami di RHAM, kita sangat mengalu-alukan program begini dan kita harapkan agar program yang kali pertama kita adakan ini akan menarik lebih ramai lagi penonton-penonton, terutamanya netizen yang cenderung untuk mengetahui dengan lebih lanjut hak-hak mereka dan bagaimana untuk menangani berhadapan dengan isu yang seperti ini yang mungkin akan melibatkan diri anda, keluarga anda dan rakan-rakan di sekitar anda. Dan saya pasti program pada hari ini insya-Allah akan memberikan banyak manfaat. However, the following is true. All people, regardless of ability level, need affections, love, and intimacy, acceptance, and companionship. Young people with special needs deserve to receive high-quality, medically accurate, and factual sexual health education. Children and young adults living with a disability may have special and unique needs related to sexuality education. This webinar hopes to provide some basic tips and tools to help you better serve youth and special needs. This is not at all encompassing training, but instead an overview of some important issues. As you all know, today is our 5th day of Ramadan, and we hope that this holy month give us perseverance and endurance to continue organizing similar programs in our area of expertise, which is beneficial and meaningful to the society and community. RHAM is a non-profit, non-governmental service provider and strong advocate of sexual and reproductive health and rights for all, particularly the marginalized and underserved. On that note, I thank you for all your participation and wish you a fruitful and interesting webinar. Thank you everyone.
Terima kasih banyak Puan Hayati. So let's start our webinar discussion on the issue of sexuality education for young people with disabilities. Ladies and gentlemen, my friends, we have two very distinguished panel members. Mereka akan berkongsi pengetahuan dan juga pengalaman mereka dalam menangani isu yang penting ini. Selepas kedua-dua mereka selesai berkongsi, kita akan mengadakan soal sesi jawab. Jadi anda yang di luar sana boleh berkongsi pengalaman atau juga mungkin ingin bertanyakan soalan kepada ahli panel. So anda boleh letak pada comment box dan juga rakan kerja saya sedang lihat di Facebook dan juga di YouTube. Dan saya akan menjadi suara anda. So sebelum ahli panel mula berbicara, sekali lagi saya nak wawarkan bagi anda yang sedang menonton kat luar sana, dan saya boleh nampak Encik Krishnan, saya boleh nampak Puan Mahela, Cik Salma dan juga cikgu-cikgu yang kat luar tu, untuk share this live session in your YouTube dan juga di Facebook masing-masing. Dan again sekali saya minta kita perlu wawarkan perkara ini. So please allow me to introduce our first panel speaker. Yang berusaha Dr. Boon Hock Lim. Dr. Boon is a special education consultant, a certified special needs education therapist, and a dialogic and dynastic art therapist. He is the founding leader of Melaka chapter for the International Association of Counselors and Therapists. He has more than 20 years of experience, and he is definitely the go-to person in Melaka and also Malaysia for support for families with children with special needs. His expertise is so well regarded and really well appreciated. He is currently has been a visiting professor to the University of St. Joseph in Macau. Dr. Boon Ho Lim, please, you have the session.
Thank you, Ms. Nora, for your kind introduction. I want to say selamat sejahtera dan good morning to all who are present. Puan Haryati, the chairperson, Dr. Kamal, my esteemed colleague, Ms. Behala, my good friend who got me into this. I really admire your long years of dedication to RHA Melaka. As alluded to by Ms. Nora, I work in the area of special education and mainly with very young preschool children, but increasingly too, I am seeing many school-age children, both primary as well as secondary, and sometimes even more mature adults. Now, the topic before us, as Puan Haryati said earlier, is sexuality education for young people with disabilities. So I want to begin by looking at this topic because this is the first in our series. Young people with disabilities. Who are they? Who are we talking about here? We have our own, in Malaysia, we have our own Persons with Disabilities Act. In fact, many years ago, 2008. And a person is defined as having a disability when they have a long-term, and it can be lifelong, physical, it can be mental, it can be intellectual, and it can be sensory impairments. And because of these impairments, people with disabilities often encounter barriers that hinder their full and effective participation in society. So that's a person with a disability. But in Malaysia also, you need to be officially registered with the Jabatan Kebajikan Masyarakat or the Social Welfare Department. And for the purpose of registration, the government has defined 7 categories of impairments, as a disability. It can be hearing, one. It can be sight. It can be speech difficulties, communication difficulties. It can be a physical disability. It can be learning disabilities. And learning disabilities is a big group. It includes disabilities like Down syndrome, people with autism, dyslexia, learning difficulties. And then the 6th category is psychosocial, where a person may have been diagnosed with a psychiatric condition. And then the 7th category is multiple disability, where the person may have more than just one impairment present. Upon registration, the person with the disability gets an OKU card, Orang Korang Upaya. And actually, it is this labeling that discourages many parents from registering their young children with disabilities. Imagine lah kalau ada seorang anak kan, untuk seumur hidup dia, seumur hayat dia, dikenali sebagai seorang yang kurang upaya, less than able compared to other people. So because of this, to UNICEF in 2019, UNICEF is a UN body in Malaysia also. It's worldwide, but in Malaysia, we have UNICEF Malaysia that works with young children with disabilities in Malaysia. And in 2019, UNICEF tells us that up to 2019, Malaysia has actually very little data on disability. And one of the causes is because of this OKU label. Anyway, they estimated in 2019, around that time, there was about 9 million youths, 0 to 14 years old, the children. And based on that, UNICEF estimates that there's about 440,000 children with disabilities in Malaysia. That's quite a sizable number, and many people believe that the figure is a lot more. Yeah. So the next issue I want to address is this. First, young people with disabilities, but now sexuality education for young children with disabilities. Why should we be concerned about sexuality education? Let me begin by sharing a little from my own experience. Way back in 2012, I was given a SINGA scholarship program by the IASID, the International Association for the Scientific Study of Intellectual Disabilities. And I was conducting a research on young adults with disabilities in transition, the outcomes of which were later presented at the Asia Pacific conference in Tokyo. For this research, it was a small research, but I conducted in-depth interviews with 12 families whose children were enrolled in a disability organization right in Melaka. They were all adult children, in their 20s and their 30s. Parents I interviewed, of course, they expressed concerns and fears about their adult children's future. But what I think at that point in time I wasn't quite ready to hear was that the mothers had decided they would sterilize their adult daughters for fear that the girls would become pregnant. And when I inquired further, every one of those family members that I interviewed felt that their children would never get married nor have a family. When I touched on the subject of sexuality, all parents became very awkward, very quiet. I had the impression that the parents could not accept the reality about their children's sexuality. So I come back to this question again. Why should we be concerned about sexuality education for young children with disabilities? I want to say three things. Yeah. First, sexuality is a part of who we are as human beings. For me, I believe that God created us, and that's good. He has created us with a sexual part of us, dimension of us. Sexuality is a normal part of growth and development. And like all people, children and young people with disabilities will develop to become adults. And this process of development includes sexual development, in interaction between the physical, the cognitive and mental, the social, relational, ethical, religious, cultural factors. So all young children are sexual beings, whether or not they have a disability, and they need affection, they need love, intimacy, acceptance, companionship. We cannot exclude them from having sexual health rights or sexuality education. And so often when a person with a disability does express their sexuality, people are surprised, they're shocked. And we look at the people with this, young children with disability, if they express their sexuality, we think they're hypersexual or they have uncontrollable urges, simply because the society around does not expect them to express their sexuality. But in reality, there are many studies that inform us that a person with a disability is not any more sexual or over-sexual compared to a non-disabled person. So denying the sexuality education for young people with disabilities can sometimes have very negative consequences. I'm thinking of examples like sexual behavior that we often consider private. Yeah, for example, touching the private parts, or in some cases even masturbating in public. And these events make people believe, they add to the belief that, you see, these special children or children with disabilities, they have uncontrollable urges. But the reality is that what they need more is sexuality education. They have not been taught properly. Now, the next bit that I want to say may be more controversial, and that is that people with disabilities have the right to make decisions about becoming parents. I still remember presenting my findings at the IASIC conference in Tokyo I talked about earlier. And here I was, talking about parents seriously considering sterilizing their daughters. None of them talk about sterilizing their sons. I wonder why. But the conference was discussing the rights. Here at the conference, the conference speakers, the keynote speakers, the breakup groups, they were all discussing the rights of people with disabilities to get married and even to have children with proper genetic and medical counseling. But back to my point, of course, if our society does not believe that people with disabilities have sexual feelings, that they are asexual, then they cannot reproduce. Or sometimes people believe that if they reproduce, they will have children with disabilities themselves. And so there are many people who believe that people with disabilities should not be parents. They're not willing to provide sexuality education. So sexuality is a part of who we are as human beings. But secondly, children with disabilities are especially vulnerable to sexual ill health. Many studies, because of time, I can't share with you now. They have increased risk of acquiring sexually transmitted infections. Children with disabilities, they have increased risk of experiencing unplanned pregnancy. There's an increased risk of falling victim to sexualized violence. And sexuality education can actually mitigate or reduce this risk by empowering children and young people with disabilities, nurturing or bolstering their ability to seek support. But despite these arguments, the research tells us, and it's sad to read through, that children and young people with disabilities actually receive less sexuality education than their peers without disabilities. Why? Because people believe that children with disabilities are not sexual. Yeah, so we have many studies from the US, from France, from the European countries, studies among young people with autism spectrum disorder. Yeah, so sexuality is a part of who we are. Children with disabilities are especially vulnerable to sexual ill health. But thirdly, I want to talk about the UN Convention on the Rights of Persons with Disabilities, 2006. This convention recognizes that people with disabilities have the right to enjoy the highest attainable standard of health, including sexual health, without discrimination. Now, you may know that Malaysia, we signed on to this convention in 2008. We ratified it in July 2010, and it came into effect in August 2010. And by so doing, what are Malaysians saying? Malaysians are saying that people with disabilities, children and young people with disabilities, they have a right to, and I quote, to freely decide and responsibly on the number and spacing of their children, and to have access to age-appropriate information, reproductive and family planning education, end of quote. That's from the United Nations, CRPD. So by ratifying the UN CRPD, we Malaysians have committed ourselves to enable people with disabilities, and including children with disabilities, to exercise these rights. And this includes the provision of sexuality education. Now I want to move on to the next section, which is what will it mean then for us to implement a sexuality education for young children with disabilities? Over the past 5 years, I was just chatting with Miss Nora before we started this webinar, that over the last 5 years, there's been lots and lots of research and publications on the subject of sexuality education. Our own FRAM and ARROW, which is the Asia Pacific Research and Resource Center for Women, published a very useful report in 2019, Comprehensive Sexuality Education for Malaysian Adolescents, and asked the question, how far have we come? And they pointed out that despite we have achieved many milestones, Malaysia boleh, we have achieved many milestones in the area of sexual reproductive health, but there are many more issues that they need to face up. Like there's still lots of teenage pregnancies, sexual violence, and so on, yeah. And it's also heartening to see our colleagues, academic colleagues from University Technology Mara, people like Salmi Razali, also asking the question, are Malaysians ready for comprehensive sexuality education? colleagues in University Malaysia Sabah, for example, just last year, 2020, were talking about knowledge, attitude, and practice towards sexual health and sexuality education. People from the Teacher Education Institute, University Science Malaysia, looking at the sexuality education curriculum, asking the question, what would be an appropriate content for Malaysian students with learning disabilities? People, the public have expressed their opinions in news media. My own colleague, the second speaker, Dr. Kamal Kenny, shot off a letter to Malaysia Kini in 2018 and said, comprehensive sexuality education is the way to go. And we have many, many more examples, yeah? In fact, a Ministry of Health from the Family Health Development Division has a training module called Live Live, Stay Safe, Reproductive Health for Children and Adolescents with Disabilities. But I'm not sure whether a more recent publication has come out, but this is dated 2009. So in fact, we have an overwhelming number of studies and resources. The question is, where do we start? I would like to humbly make some proposals here within my own context of working with young children with disabilities. And I want to start with A, B, and C. A, awareness. Start talking to the child with disability, in this case, about sexuality when they are very young. Don't assume that they are not sexual. And don't wait until they reach puberty or later for these conversations. Things like learning to undress in private. 3-year-old kid, a toddler, it looks very cute when he goes around naked. But when he turns or she turns 13 years old, 16 years old, it's no longer as cute as we imagine to be. So learning to undress, to take off clothes behind closed doors, closing toilet doors, nurturing awareness of privacy from young. Private parts, we talk about private parts, they're meant to be kept private. And using accurate language for body parts and bodily functions. In fact, again, the research tells us that when a child who has accurate language for private body parts, they are more likely to report abuse than compared to a child who lacks the appropriate language. So one, A, awareness. B, for boundaries. Teaching young children with disabilities about boundaries. Boundaries are limits in relationships within which we feel psychologically safe. When we work with young children with developmental disabilities, they have difficulty understanding the boundaries that are expected in conventional social relationships. So, for example, they interrupt rudely, they have difficulty taking turns, waiting for assistance, they may grab other things, other people's belongings without permission. So we come back to the issue about starting early, teaching turn taking, waiting for permission, asking for permission when they take somebody's things, because when they grow older, they may express sexual feelings through behaviors like intruding into people's personal space, insisting on somebody being their boyfriend or girlfriend, attempting to kiss or touch in a sexual manner. So it's never too young to start teaching. And one of the very helpful resource here is the circle of relationships or circle of friendship activity, using color codes, using photographs, or using social stories to say that it's okay for mom and dad. Kalau mak bapak tu boleh nak peluk tu boleh lah. But people whom you do not know, a distant relative, a distant uncle, you can only wave or you can only shake hands and so on. So teaching about boundaries, awareness, B, boundaries, C, closeness, as I close this talk as well. What I mean by closeness here is companionship, about relationship. Because if you think about it, sexuality is also about relationships. Young people with disabilities, as we said earlier, they will grow up into adults and they will develop crushes like everybody else. They will navigate all types of relationships, from friendships to dating to partnerships, along with experimenting with sexual behaviors. So we should not treat them differently or have different expectations for them just because they have disabilities. Rather, we must be prepared to do the research and have frank, sometimes even uncomfortable conversations with them. We can use appropriate photos, pictures, and other visual materials as often as possible, showing family photos. may help the young person to understand different types of relationships, different levels of relationships, what it means to be close and what it means to keep the distance. Using teachable moments that arise in daily life, talking about a neighbor's wife getting pregnant, what it means, about marriage, about divorce, and so on. Yeah. So A, B, C on awareness, boundaries, and closeness. And with that, I close. Thank you very much. Back over to you, Ms. Nora.
Thank you so much, Doctor. I really like your presentation, and really thank you for that in-depth presentation. You said sexuality is part of who we are, and I hope this message is ingrained in all of us. I really like the issues that you brought up about accurate language, awareness, boundaries, and also closeness. But also these are issues that concern when caring for able children, and what more when it comes to children with disabilities.
Yes.
So I'm sure out there, we have people ready with questions. But before that, please allow me to call on the second speaker of the day. Can I please introduce everyone, those who are watching out there, to my boss, the chairman of the Federation of Reproductive Health Association of Malaysia, Dr. Kamal Kenny. Professionally, Dr. Kamal is a consultant and trained social psychologist. He had his PhD in social psychology from University Putra Malaysia, and he has more than 12 years of experience in the field of training and consultancy. He is also an EXCO member of the Malaysian Welfare of Children Council. Dr. Kamal has a very keen interest in social development, and he has conducted many researches. And among one of his latest was done in 2019, not that far back, a very interesting topic on the importance of nutrition for Malaysian underprivileged students. Dr. Kamal, you have the floor.
Thank you, Ms. Nora. Thank you, everyone. Dr. Ling gave a very comprehensive overview of the situation, our topic today. In fact, many of my points that I would like to share for this session will concur with what Dr. Lim has actually shared. So I would like to just further substantiate as I go with my slides. I've got slides to share. Okay. Can you see my slides? Yes? Okay. Now, when we talk about children with disability, okay, there are shrouded with myths. Okay, so one of the key myths that people will always look at, people with disability, young people with disability are asexual. They have no sexual feelings. Now that's top on the card. Now these people are disabled people are different. As such, their desires are not acknowledged. They are always looked as eternally to be children. Even if one has reached puberty, they have always been regarded as to be eternally children. People with disability should only focus on their disability. Therefore, when one would like to express his sexual urges, sexual feelings, his emotions, people, the general public would always feel that the focus of someone with disability should be primarily on the disability. So these are the core myths surrounding people with disability. Now, so due to this, the impact of this myths, disabled people do not receive any sex education. Focus of sex education is always focused to the general mainstream people who are able. They find that people with disability, people with, as Dr. Lim mentioned, people with people with physical disability or emotional disability, with intellectual disability, should be focusing more on the disability rather than elements of sex education. Now, sexual expression such as masturbation is controlled and stopped. As such, when a caregiver or a parent sees a child who has come to age, um, 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 expressing himself in an act of masturbation is always stopped because they find that this person should not be engaging in such behavior. Now, we must understand that many people with disability, one of their key concerns that we have is that the concept of public and private domains, they are not able to distinguish. As such, when they express themselves in a public domain, people will always view them to be hypersexual. Again, this is a myth, okay? Because when they express themselves in a public domain, which is private domain, when they express themselves in a public domain when it's supposed to be in a private domain, people regard them as to be hypersexual. So young people with disability are uh, sexually assaulted frequently and at a higher rate than their able peers because of their condition. Okay, people find them to be easier prey. So people who are preying on individuals find them easier because of their condition. As such, rates of STI and overall poor sexual health is very common among people with disabilities. So we have got a lot of research that have actually showed and reflected that people with disability have a very poor sexual health. Now, how do you tackle this issue? Okay, over the and push this agenda, and we are still pushing this agenda that sex education is the way forward. And when it comes to people with disability, sex education has to start at home. The focal point has to be the caregiver, the parents, because the dynamics of sex education given to people with disability may differ from the generic sex education that we take off the card. Okay, it cannot be. Sometimes we have to customize and accommodate and change the content to suit depending on the range or the dynamics of the situation. So the general discussion consideration that we have to take is that when we talk to people with disability, especially young people, we need to reinforce the element of good touch and bad touch. Okay, they what are the body parts that one can actually touch? Dr. Lim mentioned just now that who are the individuals that can actually hug them, who are the individuals that can embrace them, and who are the individuals that they can only wave or shake hands. So this has to be reinforced to them, because we need to teach these young people that they should not be allowed to be preyed upon. Okay, certain parts of their body should not be touched. So this has to be regarded as bad touch. Empower them to say no and to reach out for help if needed. In many of my sessions in the past, I've actually done workshops for people with disability, where they have actually, after the session, have actually come to me and have said that whether it's a relative or whether it's a teacher who's actually taken advantage of them, and how do they reach out for help. So this is happening. Okay, this is happening. So it's all the reason that we have to actually reach out to this individual and tell them that it's important for them to have a certain sex education at a very young age. Be honest with young people when they ask questions. We should not at any point of time stop them from asking questions. They are very curious, they would like to know, because again, all of us are sexual beings, whether we are disabled or we are able, all of us are sexual beings. So we are curious. As such, we will have questions to ask, as much as the disabled young people also have a lot of questions that they would like to ask, that they would like to explore. So a caregiver or a parent should be prepared to answer all these questions that they pose to them. So things that one have to remember: young people with disability have feelings, sexual desires, and they also have the right for intimacy. They need a relationship. Okay, they will grow up. Okay, they have the right to have sexual desires. understand that young people with disabilities are far more vulnerable to sexual abuse than their peers. So, as mentioned, studies in the past have showed track records of many young people with disabilities have been sexually abused. As such, more the reason that we have to have comprehensive sexual education for them, give them the knowledge and the tools of knowing what how do they behave in a responsible manner in them protecting themselves, and for them not to be regarded as a likely perpetrator, because they may not know their personal space in another person's space. As such, we need to teach them to behave in a responsible manner. Young people with disabilities suffer the same discomfort and emotional trauma like their peers when taken advantage of. So please remember, whether it's an able individual or disabled individual, the degree of discomfort or emotional trauma is the same. So when someone who's disabled, okay, has been taken advantage, he also would feel the same amount of discomfort and emotional trauma. So the strategies that we should be looking at is a very important factor when it comes to sex education with people with disability is one size does not fit all. We need to look at the condition of people with disability, whether it has to be visual, whether we could be looking at what are the tools that we can use in empowering these young people when we impart sex education. They come with an entire range of spectrums. So identifying what is their disability and then catering the sex education accordingly to this group of individuals. Sex education need to consider a range of disability and customize the curriculum accordingly. And caregivers, parents, and peer educators have a role play. So it's an integrated effort. Everyone has a role to play when it comes to imparting knowledge on sex education. It cannot stop at, with a peer educator. It has to be the parents. Dr. Lee mentioned has to teach the child from a very young age, dressing, undressing, using the right terminology when it comes to body parts. So all this has to be taken into consideration. Okay, so with that, I think Ms. Nora will open the floor for Q&A. It's just that I like to stress that when it comes to young people with disability, I think we should not leave out people with disability and also focus to them. Okay, Ms. Nora, back to you.
Thank you so much, Dr. Kamal. Thank you for the presentation. I think many people forget that we are the one who should be the voices for our children, especially on the issue of CSE. And like you say, they may have added degree and trauma due to their disabilities. And another one that you would say that we should really have this mantra in our head that we should cater sex education according to the receiver. So like you say,
exactly.
Yeah, one size doesn't fit all. So thank you, speakers. The Secretariat Puan Mahala and me have been collecting questions that has been posted over the various channels that we have, because we have a YouTube channel, we have the Facebook channel, and we have this channel for the comments. Very interesting questions. So if I may start the questions, please. They didn't say who is it for, so I leave it to you speakers to decide, or maybe both of you can share. The first question is, we have heard cases of children with mental disabilities being sexually assaulted. What is your opinion about sterilization for youth with mental disabilities? I think Dr. Lim has touched upon it a little bit, but the added question is there any category where sterilization is recommended? Dr. Lim?
Yeah. I touched on it in my in the earlier talk. Yes, best as I know, there is no particular category where they recommend a sterilization. Yeah, because we're talking about rights, we're talking about providing proper sexuality education for them so that they know. Yeah. But where cases of let's say intellectual disabilities, those with severe or profoundly intellectually disabled, then you may make a case for wanting to. Personally, I would not prescribe to that sterilization, but I would encourage, maybe not to go as, I would encourage the companionship and the partnership sort of the relationship. And of course, when it comes to the sterilization, I think we will need also to have sexuality counseling, genetic counseling, and so on. There's been some studies carried out that shows that women are women, whether disabled or non-disabled, they have equal chances of getting a child with a disability or a non-disabled child. So based on some of these studies, there's a strong argument that we cannot just go ahead and just because a person has a disability, even if it's the mental or intellectual disability, just go ahead and sterilize. I think we do need to consult proper genetic and medical counseling.
Thank you, Dr. Lim. The second question is in Malay. Sebagai seorang ibu, saya perlu sentiasa membantu anak yang kurang upaya. Saya tidak tahu bagaimana saya boleh memastikan bahawa anak saya betul-betul faham mengenai pendidikan seksual. Seperti anak biasa, mereka terdedah dengan social media. Macam mana saya nak tahu dia betul faham, terutamanya mengenai kesan mengandung? Speakers?
Okay, biar saya jawab soalan tu. Saya rasa dalam konteks ni yang peranan yang paling penting adalah kita mulakan daripada ibu bapa. So dia kena memahami konsep tu dan dia kena faham bahawa cara seseorang menerima pemahaman tu tak bolehlah sama seperti anak-anak yang biasa, anak-anak yang berupaya, in this context. So as such, you must start from very, very basic. You should not expect that the child will understand the dynamics of the situation as immediate as how she would perceive it. Okay, so depending on the condition, so when the mother actually mentioned that she needs to know what's the condition of the child, so she may want to use visual pictures or to look at to share with a child and show them various pictures and how could be the consequences when the child will actually get pregnant. So that will be able, in a very simplistic way, of her trying to tell that to the child. And then she may want to ask the child back questions, simple question based on the picture, create a character in the story. It's a storytelling. Create a character and ask her in that story, assuming the story is Emmy. Emmy, apa rasanya, contohnya, let's say the child's name is Anna. Anna rasa apa berlaku pada Emmy? So that form of storytelling and see the understanding of the child based on the story. So again, we must understand that not apply with people with disability.
Dr. Lim, do you want to add?
Yeah, I would agree. Dr. Kamal tadi dia terangkan, kalau kita gunakan pelbagai jenis approach pendekatan kita, using a lot of pictures, gambar, because children with special needs, especially visual approach is very important. And then using what Dr. Kamal was saying, gunakan social stories, cerita sosial, supaya kita bukan nak tujukan personally to the child, can be a bit sensitive and a bit confrontational. But if we use it in a story, as Dr. Kamal illustrated, kalau kita ceritakan, apa rasanya this child in this situation dalam cerita ini, bagaimana and then we try to bring back to the child to try to explain. But in the end, actually, cara untuk mengajar, we cannot teach the child about sex, It's a process of growing up. Sexuality is a development secara keseluruhan is like a overall holistic development, interaction with the physical, with the cognitive, with the mental, and so on, values and everything all coming in. Jadi mesti kita banyak menekankan perlu bermula daripada from birth lah, from the child. Even like when you're changing the child's diapers, it's important. We sometimes see mothers, anywhere they just show, but you are inculcating wrong values into the child. I can take off my clothes anywhere I like, openly. And then you wonder when the child is 12 or 13 years old, you suddenly want to stop the child from doing that. Tak akan jadilah, tak mungkin lagi kan. Jadi kita mesti bermula apabila kanak-kanak itu dari seorang bayi. As long as we can start teaching and then refer to the private parts using, maybe lah, bila kanak-kanak kita gunakan lah, Chinese using bird lah, burung lah, apa itu semua kan, pet dan sebagainya. Tapi bila dia dah lebih besar, dah about to go to school, we start using the proper names. Barulah senang untuk dia fahami.
Thank you, speakers. I have another question. It says, what can society do to push government to really implement CSC for the disabled? We have done so many research, tapi belum ada tindakan. Nak buat apa lagi? I think that's a good question. Dr. Kamal, you want to take this lead first?
Okay. Now, this is what we have been doing for many years at our end in FRAM. We have been pushing this agenda, and I think at grassroots level, I think it's important. Multi-sectoral, multi-stakeholders coming together. It's important. Parents should also voice. Now that we have got social media platforms, raise your concerns. Tell them why do you feel. Then I'm sure eventually we'll be able to get the agenda. There's been a vacuum, where the policymakers as well as some agency which are pushing it. So we have not been able to bridge that gap. As such, in this context, I feel that when we have got more voices, especially parents with disabled children, the entire spectrum, trying to tell them what are their concerns and why they themselves are not able to maybe educate the child because of their of the issues they have in hand, and whether they could get support. So I'm sure eventually we will be able to achieve this agenda.
Dr. Lim, you want to add?
Yeah. I just want to add that back to what Dr. Kamal and I also have been saying, that it's a partnership thing, it's a community thing. So there needs to be community awareness in this whole thing, so that parents will be the primary caregivers. The parents are the ones who have to start the process for obvious reasons. I mean, you have the child, and when a child has a disability, the added attention is there. And then working with the educators, school teachers, those around, whether it's in the religious, dekat masjid ke, dekat church ke, mosque ke, mana pergi kan. Tapi mesti berganding tangan lah. We have to work together and collaborate and do this. I'm heartened actually by a group of youngsters from I think an online magazine, Bureau 24/7, very young people, but they came out to point out that what's happening to our sexuality education in Malaysia. Let's talk about sex, they say, because we've got like every single year, based on a 2019 study, every single year there are about 3,000 rape cases, 18,000 teenage pregnancies, 100 cases of baby dumping. If that's not reason enough, and of course, we know the rest of the story. So we need really to push, and it requires willpower from the upper ups, those in authority, our politicians, our political leaders need to have the willpower to say this is needed and then do it.
And I think, Dr. Lim, that is a very conservative numbers. There are a lot that's unregistered.
True.
Yes.
Yep.
I'm looking at time check. I think we still have one more question, because the one that's for the disabled children, what kind of contraceptive would you recommend? Is there any side effect? Dr. Lim or?
I think I would defer this to Dr. Kamal.
Well, I think that's a question that only the clinician, that child has got other underlying medical condition. Okay, so we need to take various factors into consideration before actually answering that. I mean, again, it's a blanket answer will not be right for a question like this. Because the child may have a condition, but the child may also have underlying medical condition. Okay, so only the clinician who's attending to the child, the young individual, will be able to advise accordingly.
Thank
May
you.
I add something, Ms. Nora? That, I mean, it just sparked off an article. There were some research studies on, I think, people with disabilities, and especially in this case, I think it was cerebral palsy. And in some of their cases, they have an allergy to latex. And therefore, latex condom is out of question. They were severely affected. So the studies like this are so specific, and this was just recent studies. And therefore, as Dr. Kamal earlier underlined, I think there needs to not treat everything as just one simple case, but one size doesn't fit all. So the medical side will have to come into play in consultation as well.
Thank you. Thank you, speakers. Before I wrap up, I'm just wondering whether you have a few more words to say for us to wrap up the session. Can I allow Dr. Kamal Kenny to start first, and then after that?
Yes, I think this is a very good applaud, RAM, for actually taking this initiative. You have not just looked at any generic topic to start this webinar. You looked at a specific group. There's always not been seen as a group that require a CSE, comprehensive sexuality education. So keep them in mind when we actually talk about comprehensive sexuality education. We have been having a lot of meetings with the ministry talking about children out of school, children who are marginalized and everything. And I think we also have to take into consideration of young people with disability and push this agenda.
Thank you, Dr. Kamal. Dr. Lim?
Yeah, I just want to, for me, my closing words will be ABC, to build up awareness, boundaries, and closeness, in the context of working with people with disabilities. And I highlight again that one size doesn't fit all, so there must be careful recollection. And I really want to thank RHAM for taking this initiative. I think it is a much needed topic. Thank you very much for taking the initiative. I feel privileged to be able to share on this webinar. Thank you.
Thank you so much, speakers. Thank you for being with us. And before we end, I just want to give a shout out to Puan Mahela, who is the Manager Extraordinaire of Reproductive Health Association of Melaka, who coordinated this event. So rakan-rakan semua, saya nak terima kasih kerana menyertai kami pada pagi ini. Semoga kita telah dapat lebih memahami isu ini, sexuality dan juga anak muda yang kurang upaya. Sesi ini telah direkodkan dan kita akan siar semula. Dan jangan lupa untuk menonton sesi webinar seterusnya dari RHAM. Sesi berikut saya rasa akan lebih sensasi. Mereka akan berbincang mengenai consent, kebenaran. So bagi pihak FRAM, the Federation of Reproductive Health Association of Malaysia, dan juga RHAM, Reproductive Health Association of Melaka, kami mengucapkan berbanyak terima kasih dan jumpa lagi di sesi akan datang.
Thank you.
Assalamualaikum. Thank you. Thank you, everyone.
Thank you. Goodbye.